Welcome to the lecture for Module 6 on nicotine and tobacco. This is a one-part lecture on this substance, and it's a sort of shorter lecture given that there are two substances for this module. So this is the lecture on nicotine and tobacco. There is a second or different lecture on caffeine that you'll find on Canvas as well. So starting with just some general information about nicotine. Nicotine is a chemical that's found in the tobacco plant, and it can be incredibly toxic. So just a few drops of nicotine in a solution, 60 milligrams of nicotine can kill someone. It is very, very hard to do that practically, however. So one, nicotine in liquid form isn't just available commercially. It's almost always in some kind of tobacco product. And so those products like cigarettes or cigars have a very high level of nicotine in them, but because of the way that they are used, not much nicotine actually makes it into the system. And so although it is a very toxic substance, the way that it is administered into the body means that it actually doesn't produce that level of toxicity. It is a highly, highly addictive substance. The prior Surgeon General has said that it may be the most physically addictive substance of all time. And when you survey people who are nicotine users, they will tell you the same. So 1 in 3 smokers, so people who smoke cigarettes, who are also in drug treatment for other harder drugs, say that nicotine is harder to quit than the other drug. And a little bit of self-disclosure, I'm a former smoker here, and this tracks with my subjective experience. Nicotine is an incredibly hard substance to give up. There are many different types of nicotine and forms of tobacco products. So there's nicotine that's smoked through, rolled up in cigars, rolled up in tobacco leaves and form cigars, rolled up in paper to form cigarettes, or it's stuffed into a pipe and smoked. There is snuff, which is powdered tobacco that's inhaled into the nose, sniffed into the nose. Chewing tobacco or dip that is placed in the mouth in between the teeth and the gums. And then there's also electronic nicotine delivery systems, or ENDS, which is really just a fancy name for vaping. So you can see that in e-cigarettes, or mods, which is the vaporization of nicotine in a solution, liquid solution. So how does it get in and around the body? Nicotine inhaled through cigarettes, hookahs, or vaping is very rapidly absorbed into the blood and the brain. It takes about 5 to 8 seconds to reach the brain once it's inhaled. That's true for cigarettes and hookah and vaping. For cigars, it really depends on how the user uses it. So cigar smoke is not inhaled into the lungs, so it's just kept in the mouth and then released. And so the cigar smoke being kept in the mouth, though, because the mouth has a lot of mucous membranes and capillaries there, nicotine is absorbed through the mouth by a cigar user. And so it doesn't get into the lungs in the way that cigarettes or hookah smoke does. Chewing and dipping tobacco has a higher concentration of nicotine being absorbed into the body, but it happens over a longer period of time than inhaling or smoking. Intranasal snuff, the powdered nicotine, powdered tobacco. This was once very popular. You can see it in the TV show Bridgerton on Netflix. The Queen is a fan of her snuff. There's a scene where she is requesting more of it. And in antiques stores, you can often find snuff boxes, which were really decorative boxes that people kept their powdered tobacco in, and would, have it around when they were wanting to use some snuff. Um, so in these forms, when inhaling nicotine, it reaches peak concentration in the blood within 10 minutes. But again, because it gets to the brain within 5 to 8 seconds, the effects are felt far before that. Um, and then it declines very, very rapidly. So it is both absorbed and eliminated from the body very quickly. And so it's that process that contributes to its addictive potential. Another element that contributes is that the smoker has a lot of control over how the nicotine hits or how it is felt. So depending on how how quickly it's inhaled, how long it's kept in the lungs, and how in rapid succession the inhalations occur, really can affect or modulate the experience for the user. So it's a very customizable experience. And it is a very effective delivery system. Again, it hits the brain in 5 to 8 seconds. And so it's a quick hit and it's a potent hit, but then it leaves the body quickly. So you're getting that quick to experience the rewarding sensation. The rewarding sensation leaves, so then you get the person craving and wanting more right away. And that's what makes something more likely to be addictive. Uh, Nicotine is broken down by the liver and kidneys and eliminated through the urine. And however, there is one type of an active form of nicotine. It's a sort of byproduct that can linger for a couple days in the urine. And so it would create a positive blood test. This metabolite is also found in the bloodstream of infants of smoking moms days after birth. So even though it gets in and gets out pretty quickly, there are some nicotine byproducts that can still be found in the body for a couple days. So what does nicotine do to the brain? Well, it mimics and it activates the neurotransmitter acetylcholine. So specifically the nicotinic acetylcholine receptors. It excites those receptors and it increases the signaling between them. So it is a stimulant, which is why we're pairing it with caffeine. It's another legal stimulant. Um, but though people are reporting that it feels like it calms them down, and we'll talk about this in a moment, that's almost certainly behavioral. So it's more about the process of smoking and less about the drug itself, because the drug itself stimulates neurofunctioning. Nicotine also raises dopamine levels in the brain, so you get that kind of pleasure response, and that is amplified by cigarettes because of other additives in the cigarette itself. So cigarettes have thousands of other additional chemicals aside from nicotine that really complicates our understanding of cigarettes addiction and how to distinguish between the effects of nicotine on the body versus all these other chemicals that are in the delivery system, aka cigarettes, for nicotine. Nicotine also stimulates the release of adrenaline in the body. And so that has some implications for the heart, which we'll talk about in a moment. And it is possible that the increased acetylcholine production can enhance the memory function. So nicotine by itself, without the added toxins in cigarettes, is far less uh, damaging to the body on its own. The trouble is we really can't separate those two because it's almost always consumed in the form of tobacco leaf smoke or cigarettes, which are added with extra chemicals. And so the health costs of smoking tobacco far outweigh any potential benefit on memory function. But that isn't to say that it's not there for something that's stimulating acetylcholine and the part of the brain responsible for memories, like the hippocampus. The immediate effects of nicotine are an increase in neural activity, tremors or kind of shaking away in the body, feeling kind of nauseous or vomiting, but that goes away pretty quickly. And that's with more of like a lot of nicotine entering the body in a short amount of time. It also stimulates the release of antidiuretic hormones. And so that means that it slows down the production of urine and leads to fluid retention. So diuresis is urine production. So antidiuretic means anti-urine production or slowing urine production. And so it's holding on to liquids and fluids in the body. Um, you're going to see an increased alertness with the short-term use of nicotine, and all of these things are lasting for 10 to 20 minutes. Again, enters quickly, exits quickly. If someone does manage to ingest a excessive amount of nicotine in the body, then you can get nicotine poisoning, and that person can experience heart palpitations, dizziness, sweating, nausea, vomiting, and it can require hospitalization. You'll remember I mentioned a moment ago, nicotine can be very toxic at high levels. Subjective effects of nicotine, how does it feel? So nicotine doesn't really produce any mind-altering effects or a high, unlike other drugs. There isn't really an intoxicating effect of nicotine. People are kind of functioning normally on nicotine. And in fact, they're more likely to report feeling calm or relaxed as a result of smoking nicotine. Um, but again, that's not really a result of nicotine itself. So nicotine itself is a stimulant. But that calm, relaxed feeling is coming from the smoking process. So the habits and the rituals associated with smoking become a kind of security blanket for the user. Um, and I think two other factors that aren't mentioned in your book, but from personal experience and from my training as a psychologist, there are relaxing effects of taking a smoke break. So often the way that cigarettes are used now, you can't smoke indoors, you can't smoke, where you work. So in order to go smoke, you have to stop what you're doing and go take a 5 minute break, usually outside. I think if any of us stopped what we were doing and took a 5 minute outdoor break, whether or not we smoked a cigarette, we would feel more calm and more relaxed. The other thing that happens when someone smokes cigarettes is the inhalation process. They take a deep breath in and a deep breath out. And that kind of diaphragmatic breathing can have a calming effect on the body, even when someone's inhaling a stimulating substance. So that's why people who smoke cigarettes say that it's a stress relieving act, because of the smoking process, not because of the nicotine substance. And then people who smoke often say that they experience reduced appetite, so they don't feel as hungry when they're smoking. Long-term effects of cigarettes and tobacco products are numerous and they are deadly. So people who smoke are at higher risk for heart attacks, for emphysema. Um, I think and your book mentions this, the impact of smoking on the cardiovascular system is not as widely understood. It's like, yeah, we all know that smoking is bad for your lungs, right? Lung cancer, trouble breathing with emphysema, COPD, or chronic pulmonary disease, right? We get that. But cigarette smoking is the number one risk factor for heart disease. So it affects your whole body. And that's related to the stress and the strain that nicotine, but also carbon monoxide from the combustion of smoking and the smoke itself puts on the heart. It causes an immense amount of strain, and the heart over time just cannot keep up with the demands that are being placed on it from smoking. It results in low birth weight in babies whose moms are smoking while pregnant. Smoking after a baby is born is related to SIDS and infant deaths. And also, cigarette smoking increases the risk for stroke, especially among women taking hormonal birth control. So, estrogen and nicotine are a very bad combination, and hormonal birth control usually has estrogen in it. And because of that, it increases the risk for strokes. Pre and postnatal concerns. So nicotine does pass through the blood to a fetus of a pregnant woman. There is a reduction of oxygen to the fetus, a constriction of blood flow. There's exposure to the fetus of damaging chemicals. And then also once the baby is born, then there's an issue with smoke in the environment. So we're seeing things like low birth weight, SIDS, childhood cancers, disruption in their development, hyperactivity, and then also just growing up in an environment where people are smoking increases your likelihood of future nicotine addiction for that child. The DSM has some criteria for tobacco withdrawal. So again, that daily use of nicotine, and then when nicotine is stopped, if four of these are experienced within 24 hours, then you're getting withdrawal. And so again, withdrawal tends to be the opposite of intoxication. And so in this case, you get that kind of slowing, depression, insomnia, that kind of irritability, difficulty concentrating, all of these things can be withdrawal symptoms for nicotine. Directly smoking is not the only danger associated with smoking cigarettes or tobacco products. Secondhand smoke and side stream smoke are both really problematic if you're experiencing them. Secondhand smoke would be breathing in the smoke exhaled by a tobacco user. Side stream smoke is inhaling the ambient smoke that's coming off the cigarette itself. So a lighted cigarette is releasing smoke that hasn't gone through another person's body. And that smoke can actually be more damaging than smoking a cigarette. So you've got two people in the room. One person is smoking a cigarette. That's bad for them. The other person is inhaling the smoke that the smoker exhales. That's secondhand smoke. That's bad. But that other person is also inhaling smoke that's coming off the tip of the cigarette. And that is the worst form of smoke that's being inhaled in the room by anyone. And it's because it contains more unburned particles that have more toxins in them than smoking directly through the filter like the smoker is. So secondhand smoke is a carcinogen. It has cancer-causing toxins in it. It's the third leading preventable cause of death behind regular smoking and alcoholism. It's dangerous to pregnant women and babies, and it's also related to heart disease. So this is a lot of the evidence that was presented that got cigarette smoking banned from bars. And it wasn't so much the patrons, because you can choose to go to a bar or not, but it's the workers and the employees at bars who were being exposed to secondhand smoke. And that's really what got those bills passed almost all over the country. Quitting nicotine use is very, very difficult. Cravings can persist for years, even decades. The book mentions that cravings, the physiological cravings stop pretty quickly, but the psychological cravings and the psychological association for nicotine really lasts a very long time. And it's because through smoking, smoking is something that occurs so frequently throughout a smoker's day that it becomes paired with so many things in the environment. It becomes paired with the first thing they do when they wake up. Then they have a smoke with their cup of coffee. It comes paired with after meal times. When they're finished eating, they go have a break. When they are talking to a particular friend or they're meeting someone for drinks, like smoking becomes just infused throughout the smoker's life. And so while the physical addiction to nicotine might go away pretty quickly, all those other behavioral associations persist for a very long time, and so must be dealt with in terms of treating someone for nicotine addiction. But going back and thinking about physical addiction, there are lots of options for managing the physical withdrawal symptoms of nicotine in the form of nicotine replacement therapy. So this can come in the form of a gum, a patch, a spray, or inhaler, lozenges, or hard candies. And then also there's an option for Zyban, which is called Wellbutrin for depression. So it's an antidepressant, also helps users quit smoking, and Chantix. And Chantix is an interesting drug because it is a nicotine agonist. So it's a substance that binds to the nicotinic receptors and signals them to go. So it releases that sensation, but to a lesser degree than nicotine does. So this is like the methadone for nicotine. So methadone is a agonist for opioids. I mentioned in one of the first two modules. So this is a really effective nicotine replacement therapy for people who are trying to quit smoking. All of the methods that I mentioned are successful in helping people quit. There's really no difference in the effectiveness. And when you combine them with therapy, you get better outcomes. And there really aren't any long-term consequences. So there's really only upside potential to using these nicotine replacement therapies for smoking cessation. But even so, most people will relapse after approximately 6 months. So, like I said, even though those physical cravings are gone, those intense behavioral associations persist. And really, the thinking is that's what's contributing to relapse. So, in terms of helping someone quit smoking, that's going to be a really important component to treatment. That's it for nicotine and for Module 6.